Welcome to Senior Moments. I'm Vickie Carraher, the Senior Service Coordinator for the City of Kettering. I have one of my all-time favorite guests here today. She's just been released from house.
They've unleashed me to the public.
She's been gone for a while, but we're so glad to have you. Theresa Buscher from the Social Security Office, and we're going to talk all things Social Security. So how long was the office closed during COVID?
Oh my goodness. Well, first of all, back at you, my friend. It is great to see you and to be here with you live and in person, although we're laughing. We have like a COVID distance between us. We're safe, my friends. We're all safe. It was 2 years. Can you believe that, Vickie? About 2 years. And I will back up and say, when I say 2 years, I don't mean that we were closed. You all know we were up and running, but all remote. Now, we were bringing in the past year plus, we have brought people in person into the local offices, but that was all by appointment. And you had to be screened before you got an appointment. So for a lot of folks, we were like, I'm sorry, we're not even going to bring you in for an appointment. Even if you asked for it, you weren't going to get it. Because if we could do that transaction that was needed on the phone or online, you didn't come into the office. And we thought last year in 2021, we were going to be open by summer. Well, then some parts of the country had Delta outbreaks. Then we had other Delta outbreaks in fall? You know, and then that was when we were supposed to reopen. And then we were supposed to reopen like January 3rd. That was the big one. And Omicron came in different places. So it was like, okay, we were happy to say that as of April the 7th, nationally, across the board, all Social Security offices are open to walk-in appointments again. So that is something that we really have been thrilled about and worked hard to be able to do for the public and for our employees, et cetera.
Explain to me, so when you say walk-in, what are the things you can do walk-in and what are the things that you still need to do online? So give me a little clearance about that.
I think the biggest thing that we're seeing right now that folks need us for to walk in is Social Security card issues, which I think makes sense to most of our viewers, because we were doing Social Security replacement cards all this time, but boy, it was tough, because then you had to drop off evidence in a drop-off box, and that could be very upsetting because you don't want to drop off original documents sometimes. And people have done it, and I so appreciate those that rolled with things and have done this, but the majority of our folks coming in the door need to change a name, need to get a replacement card for a child, and those are things you cannot do online. So hang on, we can talk in a moment about most folks. If you just need a new card, like a replacement card, you can do that online if you're an adult. But kids can. You can't do a child's online. So if your child needs their temps or whatever, you know, you're going to have to come in to do that and change your name. Again, we thought the technology was going to be there, but it's not there yet. So when you come in, that's so nice, because it's working very well in most of our local offices, where if you need to do a name change, et cetera, just make sure you bring in original documents. You guys, we can't see any copies. So you need to have like your original marriage certificate or your original divorce decree. If you had a court order name change, bring in your court documents plus a photo ID. I always say plus bring in your your driver's license, etc. For a child, if it's your kiddo, you think about 2 people: ID for you, ID for child. And you know, parents will say, "What do you mean my child's 5?" Like, what ID are you talking about? A birth certificate? No. Birth certificates are something we use electronically when the child's born. Okay, so, and for all the kids that are born in the hospital, et cetera, we actually cross-check that with vital stats. So it's weird, because after that original card that we all get at some point, the birth certificate, just shelve it, because that's not an identity document in our Social Security world. So parents, bring in document for you. That'd be your driver's license for parent. And an ID for a child normally is either like a school or daycare record or medical record. So talk to your pediatric, provider's office. What you'll need is child's name, child's date of birth. And you've got, but make sure the pediatric office puts like their, how they'll do their official, you're in the field. Thank you, Vickie. Like an official stamp or something like that on it from the school or the child, and that will be your identity for the child. But if you look on our socialsecurity.gov website, there's a lot of good info, but that, about documents and such. But I think that has been the biggest one, honestly, Vickie, that people were not able to easily do remotely, and it's been a game changer for the public because, again, you don't have to have an appointment, my friends. You just come on down and take a number, and we're gonna help you out there. All local offices have the same hours, 9 to 4.
So it used to, Wednesday was a shorter day. No longer happens.
All days,
Okay.
Monday through Friday, 9 a.m. to 4 p.m. You can also call directly to a local office during those are like our public intake hours. So we're there. The offices have folks in them and staffing, remotely, because we're kind of in a hybrid. Sometimes our staff's still rotating in. Before and after 9 to 4, but those are our intake hours. So for you to reach us via phone or in person, it's 9 to 4. The local phone numbers are all online still. This is something that kind of changed with COVID. So if you go to socialsecurity.gov/locator, like locator, or just type locator in the search button, you can find your direct line to your local office. Now the 800 number, we have a call center too. I know you're kind of familiar with that process also, Vickie. You've had to help folks call us, I know. That has humans 8 to 7. So it's expanded more, 8 a.m. to 7. And our national number is 800-772-1213. You probably have that glued in your brain.
I do. That's somewhere in the back
Somewhere
of my brain.
800 SSA 1213. Now it's also got like a 24/7 robot. So let's say you need like an address change. You could actually do that like on the little robot. It works.
Cool.
It does work. That's a 24/7. The only thing I can tell you guys, with calling the 800 number, it has been better. Okay, since we kind of have folks coming in with walk-ins, it's less than some of that phone traffic. With the phones, earlier is better. That's the only tidbit I can give you.
Yes.
Try to call like at 8. And try to get on the phone.
That's what
early.
I tell him. I'm like,
early is better.
Eat breakfast, then,
Eat breakfast with Social Security.
Early breakfast, get your Social Security, call and just wait.
Call and wait. It's not so bad early in the morning. The rest of the country is not coming on. The West Coast isn't online or, on the phones yet. And it is better because we used to have these awful voice prompts and phone prompts. You'd have to go through like 5 or 6 prompts. It was awful.
I thought one time I was trying to call you, I thought I was going to have to give blood in order to get to you.
Exactly, yes. So this is a lot better in terms of the prompts. When you call, you're asked, what do you want? And you can say representative, appointment. Either one of those, you go right into that queue line. So I'm thankful to say it's much better.
So if I'm filing, I'm filing for Social Security, I'm filing for a benefit for widows or for my children, that still, there's a different process for that.
So when you're filing an application, normally that's going to be 2 routes. You're going to do a phone or you're going to do online.
Okay.
So those are still remaining pretty much a remote option. If you walk into a local office and say, I want to apply, I want to apply for benefits right now, we will take care of you, but it's not going to be the application done for the most part right then and there. And like we were laughing because I have had some folks say to me also, like, I came into the office and I said, I just want to file for retirement. And they said, okay, we're going to make you an appointment. You can do it online or we're going to make you a phone appointment. And the person said, but there weren't that many people in there. And I was like, I want to do it now. But the days have changed because when you come into a local office, we're still masking because of the nature of our population. We have a lot of folks that have very serious conditions and impairments. We have a lot of folks who are older and again could have pre-existing health concerns. So we're not getting any issues with that. People understand. We have masks, don't worry. I mean, we have them there for you, so we'll offer you a mask when you come in. And our lobbies are social distanced also, again, just for kind of protection for everyone right now. And we just don't have a ton of space for folks to wait. So I know it may seem like, oh, there's not that many people here, etc. But it's one of those things where our folks, again, have very set times and appointments, and we're going to make sure that you're taken care of. And when you come into the local office, even though we're not able to do an application for you immediately, it's as if you filed that day, Vickie. And sometimes people don't realize that, I think. So even if I walked into a local office at the end of the month, it's like, let's say it's, May 28th when I come in. That's the day that you filed then with us. Even if we don't take your appointment for several weeks more, you have protection of benefits and all that. And again, we prioritize cases. So if you're saying, I have a critical need, my spouse passed away, I have no income, I have nothing, I have no health insurance, we need to do Medicare, then we're trying to prioritize those cases, and we should be able to do that very quickly for you.
One of the good things that came out of the pandemic is it used to be you couldn't do a lot of the Medicare application online, and now you can. And some people who kind of feel like, well, I'm trying to do this application, I'm not web savvy. I had a lady tell me, I think I messed up all of the internet by putting in, and
I know,
so
it can
they're
be
afraid.
very daunting.
Yeah, they're afraid that they're going to mess up your website, but you can do that. And there are people like I do that at the Kettering Connection in Town and Country Shopping Center, and our number is 937-296-3330. So go ahead and give us a call, and we will, help you with that application.
Oh, thank you, Vickie, for bringing that up too. And don't feel like you have to do things online. I just think for a lot of our folks, it works. You know what I mean? A lot of, because think about it, for folks who are, say, 65, that's still Medicare age. If you're 65, that's the earliest, I should say, that you can get on Medicare based on age. The majority of our 65-year-olds are working, and the majority of our 65-year-olds are online all the time, so it's like, no big deal. However, I get it. You and I understand. I've teased over the years, it's not like buying socks on the internet or something.
It's not.
I mean? So it can be very anxiety producing. However, I think the majority of our folks are happy with the application process because you go through it online, you get a confirmation code, and you can track it in your My Social Security account. So there's been a lot of good things in that sense, technologically speaking, that have come out of COVID in terms of people having more of a comfort zone filing. And for folks that are working and who've delayed Medicare past 65, which you again can help them with the Kettering Connection. You know our enrollments and all that stuff, bless you. But again, Social Security can also walk you through this process on the phone too. But you can do now what we call a special enrollment into Medicare A and B. And again, that's something that's very common. And that's where you're past 65 and you've been on work insurance. So say that I retire now and I'm 67. Okay, now I need Medicare because you can delay past 65 safely if you or your spouse has current work insurance. But all of us hopefully will retire at some point. And when I retire, yay!
Fingers crossed.
Then when I retire, I'm going to go on Medicare, right, as my base. And so the great thing is you can do that all online too. So you can submit the proof of your, when you want your Medicare to start, proof of employer coverage, and our system walks you through it. So if you go to socialsecurity.gov, right front and center, there's a Medicare tile. Click on that, and we scroll through, and we literally walk you through how to do that. So,
one of the things that I hear all the time is I hear people, since you are the window into Medicare, people come to my office going, I want you to sign me up for Medicare, and I'm like, I can't do that. I'll have to help you with it
individuals
online.
have to sign their own application, and that's again for all of our own protection, isn't it? So like you said, you can guide, and we at Social Security can guide, but it's sometimes one of those situations where it's comforting and can also be offsetting at the same time to realize you have to do your own decision making, so to speak, right? You have to decide when you want your benefits to start. You have to decide when you want to go on retirement. Now, for a lot of us, like I said, that determination is made. When you are past 65, if you don't have work insurance anymore, you are going on Medicare A and B. You need it. I mean, for the vast majority of our folks, you're going to need it, right?
And if I get my Social Security, let's say at 62, or if I am disabled, you don't even have to file if you're already getting Social Security.
So that decision, again, for most of us, is going to be an individual determination. I was talking with someone online the other day. We were emailing back and forth, and she was saying, I just wish I knew when was the perfect time to file for my benefit. And I said, well, again, not to make it more of a burden, but it is and some of these things are our own determinations. Each person is going to file, because as you mentioned, Vickie, the earliest you can do retirement 62, right? The earliest you can do a widow or widower benefit is 60. Does that mean everybody's going to go on at those ages? No. I'm saying that's the earliest age factor for both of those. You have reductions if you start early, yada, yada. But if you go and you say do retirement at 62, that's a reduction in a benefit, but you get a benefit early. And then as you said, if you are on any kind of benefit, widow, spouse, on an X, whatever, and you come up on 65, it's an automatic enrollment into Medicare A and B. And that works like clockwork pretty much, doesn't it? I mean, folks get a welcome to Medicare packet, the card comes in the mail, and that's about 2 months before your birthday. I mean, sometimes people will say, I know you and I both had this happen, where they'll say, well, I'm turning 65 next year and I don't have anything yet. And we're like, that's too early.
Yeah.
Okay. As long as you're already on Social Security, that'll come about 2 months. That's what we're seeing still. But before your birthday, you get the card, etc., and that puts everything into motion. If you're 65 though and you're not sure, because we have tons of folks that are 60. Think of your own life. You have tons of people you know they're 65. Some retired, some working full time. So it really depends on the individual situation. If you're already on Social Security, fine, it's automatic. If you're not and you're 65, then we want you to think about Medicare, because if you're retired, you need it. If you're, you might have retiree insurance and you need it. And I give folks the example. We see a lot of folks in our Dayton area, don't we, that are TRICARE? Yes. So that's military retiree insurance. And maybe I'm working full time and I'm 65, but I'm not in my insurance at work. You know, maybe I'm working for a research lab, I'm a contractor or whatever. I don't want Social Security yet. I'm working, right? Exactly. But I get a letter from TRICARE that says, you know, dear Theresa, you're 65. You need Medicare. And I'll be like, Vickie, is it true?
Yes, it is.
Yes, it is. I'm going to tell you, it's true. You do need it, because that's a form of retiree insurance. So then you're going to need to go into Medicare. But the cool thing is, again, you can do that online and just say, all I want is Medicare. Don't want Social Security yet, because I'm working still,
It's actually pretty easy. Even I can do it. You scroll down and it has a little tab that says Medicare only that you can press. One thing that really is confusing is people will say, well, I'll ask Social Security what drug plan I come on. And, you know, I tell them you're the window into Social Security, but when they get, or into Medicare, I said, but when you get through that window, then they shut the window and you work it out on the other side.
It's so true, because we laugh about being cousins with CMS and Medicare. So we're in parallel universe tracks where we get you into this universe, but then you kind of float away. In terms of Social Security, we enroll you in that base of A and B, but we don't do the Medicare billing, as you know, because some of your folks might come to you with the explanation of benefits or different things, and we're like, oh, that's not us. Getting on a drug plan or determining if you need what, you know, Medicare Advantage or a supplement or all that, we refer folks to you, and also to the OSHIP, right, to the Ohio Department of Insurance, to, you know, for good neutral counseling to see what your options are for that. And I wondered if it was okay to talk for a moment about that My Social Security account.
Absolutely, because that's a game changer for people.
Well, and I want to back up and say that when you go online, and you've seen this, I know, to file for Medicare only, or you do retirement, because sometimes people do it all at once too, depending on, maybe I'm retiring at 67, and I'm like, okay, baby, I'm ready. You know, I'm going to do retirement and Medicare, and you can actually roll that all like into one big application. The first question we ask you is, do you have a My Social Security account when you're filing that application? So if you say yes, then you're going to be asked to sign into the account. And that's actually a way that we identify you. Okay. You know, because you'll have, like, you've got your username, which is also usually, sometimes it's your email, sometimes it's another username and a password. And then you get a code, you know, like you do with banking and that type of stuff. And once you kind of go through that, you're into the application. And it's great because, again, in the account then, your My Social Security account, you see it. Yeah. And it actually shows you like the stages, like it's being processed, or, you know, and everything updates overnight with us. So I've had folks that say, I check it every single day, and I'm like, good, keep doing that, because then you will see, like, in real time over the next morning what's going on with your case. Now here's the issue. Sometimes maybe when you say, I have a My Social Security account, if you say yes, maybe you can't get in it. You know what I mean? And that can be a bummer, because I've had folks say, I know I have an account, but I haven't looked at that thing in 5 years. And
guilty.
I see. Okay, so this is my Theresa homework. Try to sign in before you're like doing the application. And that way you have plenty of time, because usually folks can get back into their account, because if you've forgotten your username, that you can easily reset online. But if you've forgotten your password, if you can't reset that yourself, usually you have like security questions, you know, what was your first pet's name, those types of things. If you flunk those, it's okay. It's okay. But you're going to have to ask for a new password. Either way, like you can do this all self-help yourself. You know what I mean? I'm online and I say, I want a new password. It's mailed to you.
Oh,
so
wow.
usually, and that takes like 2 weeks. And so that can be a real bummer for people like trying to like get in. So I would say my recommendation is before you're doing it, try to get those issues resolved. Okay. If you can't get your issues resolved, you can also call us, the local office or the 800 number, or on this one you could walk in and we could also cancel out an old account for you and you could restart.
Okay.
If you haven't done an account lately and you can really easily get in. I don't know if you've seen this anymore, Vickie, but now you use login.gov to create an account. It is easier than it used to be. Because we used to make people like upload a driver's license and answer credit questions. It's still a behind the scenes process of, identifying and such, but it's easier. A lot easier. And those of you with younger kids too, we used to like have a horrible time for like an 18 or 19-year-old. They don't have a lot of credit. And those young ones could not get onto a My Social Security account for anything. And so if you want to replace a Social Security card, again, there's no name change, etc. We've had a lot of young ones going to college, right, getting jobs, and they're like, all I would just want is another card. I just can't find the old one. They're not changing their name. They're not doing anything different. And so we'd say, go online. Because through the My Social Security account, you can do it on here. Well, when they would try to get in, they flunked because they're young and we couldn't identify them. But this process with login.gov is working, so our younger ones are having so much more success. So even young ones, you have to be 18. Under 18, it's not going to work, you guys. So for getting temps for driver's license and stuff, it's not going to work. You're going to need to come in. But for 18 plus, we can do that online, and it comes within like 2 weeks. It's kind of like a driver's license process now. You're not. It's mailed to you. So even if you come in person to the local office,
they have to mail it.
We're going to mail it. It's not. You're not going to leave with a card.
One of the things that I like about that account is people come to me all the time. They're applying for benefits, public benefits, and they need that 1099 form. That form that says this is how much you make. That everybody who applies for any kind of assistance needs some of that. And if you're like me and are not really good about putting things together and keeping it takes me, I'm like, I know this form is in here somewhere. So tell us what some of those things you can do.
It's at your fingertips. So it's an estimate tool when you're not on benefits. And again, you can do some things with us, like when you're not on benefits. You can get the replacement Social Security card. You can get this amazing calculator tool. I don't know if you've seen this thing, Vickie. It's awesome because it's like you can drill down to like an exact month. You could say, well, what if I retired and it was 63 and 2 months versus 63 and 3 months? It's that detailed. It's fabulous. Now, for folks, though, that are under OPERS, like if you're working for the city of Kettering or any of our county municipalities, state teachers, there's a lot of you listening that are in these systems. SERS for School Employees Retirement System, OPF, Ohio Police Fire. These are also what we call parallel systems because you're paying into that system versus Social Security. Note, danger, and that estimator tool for you, it would show you if you've got enough for a Social Security benefit. So if you are in OPERS or state teachers, etc., and you have a benefit, Vickie, it shows a benefit estimate, you're going to get something. I promise. You will get something. Now, it may be dinky, but you're going to get something on there, and it'll show you if you have enough and how much your benefit will be. And if you don't have your 40 credits, which is the minimum now pay-in for retirement, the statement, the estimate will show you how many credits you have. So that's a planning tool for you to use, but you need to do a step 2 if you're in one of those systems, and you need to use what we call the windfall calculator. So step 1, create the account, look online. Step 2, use the windfall calculator to give yourself a really good number crunch. But excuse me, when you look online, you can also get an estimate. I should say a statement that you don't get Social Security because, excuse me, believe it or not, sometimes folks have to prove they don't get a benefit from us. And so you can actually print that out that says, I don't get any Social Security. I'm 24. I don't get it. So you can print that out also to show you're not
I
on anything.
experienced that when I was helping my brother who's in the PERS system. It was kind of frustrating. They kept saying, that's not the right form, that's not the right form. And I'm like, I don't know what form you want. So it's nice that you can do that from that
So you can do that even if, again, you're not getting a benefit, but you can print out, I'm not getting
a
anything.
benefit, yeah.
You know? Now, sometimes people ask before you change into being a beneficiary on the online account, folks will sometimes say to me, I don't have an address like on there I can change, which is kind of weird. You know what I mean? They'll be like, why is there like no address on here? And it's because we really don't keep an address for you on file, because if you're not on Social Security, we don't really care.
Keep track of
I know
you,
it's weird, but I know it's kind of comforting again.
They're not keeping
There's
track
no
of
big
it.
brother here, you know, and the born identity is not tracking your every movement with Social Security. So really what we need to do is we keep up with you with an email address, you know what I mean, with that. And you can change and update that in your account. And again, when you file for benefits, the My Social Security account shows you that you filed. You can track and see where your application is. And then overnight, things process. And once you become a beneficiary, it's like, woo, voila,
Ta-da.
and ta-da. And then you've got this portal, and it's fabulous. In the account, and this is for folks that are on SSD. This is for folks that are getting a survivor benefit. This is like a widower benefit, etc. You can see your monthly amount, the gross, if Medicare is being taken out, benefits back for 2 years, and when your next payment's coming into the bank. You can change your address. You can change your bank information. So there's a lot of great stuff. And the documents part is just a game changer, because I know you know a lot about my situation and family life too. And you know, Vickie, that my mom struggled too. And when mom was alive, I would have not been able to manage. I can tell you guys this from a personal perspective, without having that tool to help my mother, because we couldn't find, when she needed senior housing, I didn't have I'm like, where's her proof of benefits? And my mother would say, honey, you work for Social Security, just go get it for me. And I would be like, Mom, I can't do that, because I can't, in federal privacy, I can't look at any of my friends or family stuff online. Now, I was able to help my mom, though, with her account. And so a lot of you are doing that to help your loved ones. The thing I will tell you is you cannot set it up for them, though. The mom was with me the whole time. She knew exactly what I was doing. I helped her make the account. You can help your loved ones set it up, but they have to be aware, because it is their account. It is not yours. The only time you can look at somebody else's stuff, so to speak, is if you become their payee. Okay, and this is when your loved one becomes cognitively unable to handle their Social Security benefit. So if your parent ends up, say, in a dementia unit and cognitively impaired, you may have to step up to be the payee. And there's only one person. Maybe there's 5 of you siblings that are around, but one of you needs to be like a trustee. And then if you're the payee, say I become my mom's payee, I have my own, Theresa, my Social Security account. I'm not on benefits yet. So when I would go in, I would see like 2 choices. It'd be like Theresa's information here. And if I was my mother's payee, it would have her information here, like her own portal. And that's a game changer. That's happened since COVID, where our payees now can go in, print out the benefit verification. So if mom had not been able to take care of her stuff at all, and I became her payee, I would at least have that portal to transact business as a payee. So it's important to note.
We're running out of time. I want to thank everybody for tuning in today, especially you, Theresa. It's so good to see you in person again. If you have any questions, contact me at 937-296-3356. Thank you.